I'll edit it and take it down.
Is it recording? Okay. Good morning, my name is Shiv and this is Randy. And I'm going to be performing an examination of the shoulder. For the purposes of this examination, I'm going to focus on the right shoulder given the time constraints. So Randy, during the examination I'll be talking to the camera, if that's okay. Yeah. What I'm going to ask you to do is just to perform a few movements, have a feel of your shoulder. If you have any discomfort at any point, just let me know and we can stop the exam. Is that okay?
That's fine.
Fine. So to begin with, I'm just going to start by inspecting the shoulder from the anterior point of view, comparing both sides, looking for any evidence of any asymmetry, any evidence of any scarring to suggest any previous operations, and I'm also assessing muscle atrophy. I'm going to move over to the side. Looking from the lateral point of view, there doesn't appear to be any abnormalities here, and looking from behind. And when I'm doing this, I'm just assessing to look for any evidence of winging in a scapula, and again assessing muscle bulk as well. So there doesn't appear to be any abnormalities on inspection, so I'm going to move on to palpation. So I'm going to start at the sternum, then move across to the sternoclavicular joint, and across the clavicle, and over to the acromioclavicular joint, and feeling for the coracoid process, and along the margin of the anterior and posterior aspect of the glenohumeral joint, feeling for the biceps tendon and across the deltoids for any evidence of any muscle atrophy, and then across the spine of the scapula, along the medial aspect and along the lateral aspect of the spine. It doesn't appear to be any abnormalities on palpation. Was there any pain during that? Okay. So what I'd like to do is just to ask you to perform a few movements just in your right arm. So to begin with, I'm going to assess for shoulder flexion. So if you just move it forwards like that for me, that's fine. And now all the way down and all the way back. So that's assessing for any extension, no abnormalities there. And all the way up and all the way down. Okay, now if you put your right arm like that for me, and then move it outwards for me, and then inwards. So we've assessed abduction and adduction, external rotation and internal rotation. Finally, I'd just like to assess for function. So if I can get you to just put both your hands behind your head for me there. Mm-hmm. Any problems there? Nope. And now both your arms behind you, feeling as far up as you can. So both hands are able to reach the bases of the scapula, so that's a normal test. Fine. So now I'm going to repeat the movements, and I'm going to take the weight of your arm and do them for you. Whilst I'm doing this, I'm just putting my hand on the shoulder, feel for any crepitus, and as I do this, passive flexion, there's a little bit of crepitus in the shoulder, and extension, that's fine. I'll take the weight there. Again, some crepitus on abduction, and none on adduction, and I'll just do the 3. So this is passive external rotation, passive internal rotation. Doesn't appear to be any abnormalities. And when I was assessing the passive abduction, I was also considering the painful arc between 60 and 120 degrees, and there didn't appear to be any pain there. So now I'm going to again repeat the same movement, but I'd like you to resist. This is resisted movement. So if you can just move your shoulder forward like that for me. Any pain there? Nope. And backwards, fine. And then out to the side for me, and then in towards you, fine. And if you put your arm like that for me, and just move it outwards for me, fine. And inwards, fine. No pain there. So that's resisted movements. Now I'm going to move on to special tests. So to begin with, I'd just like you to put your right arm onto the opposing shoulder there, and that's a scarf test assessing for any AC dysfunction. Is there any pain when you're doing that? No, okay, fine. So the next special test I'll do is the empty can test. So if I can get you to lift your arms like that for me. Okay, and just move them forwards up to about there. Okay, and now if you turn them upside down like that for me, and when I'm pushed down, just resist. Any pain when I'm doing that? No. No? Okay, so that's assessing the supraspinatus tendon. And there doesn't appear to be any abnormality there. So the next test I'd like to do is Gerber's lift-off test. So if you put your arms just to the base of your spine like that for me, and I'll come around, and if you just push your against so one side at a time, so the left-hand side push away, fine, and the right-hand side, fine, and doesn't appear to be any pain when doing that, and that's assessing for the subscapularis. So the final test I'd like to do is the apprehensive test. So I'm going to take the take the weight of your arm here, and so I'm placing my hand, stabilising the scapula when I'm doing this. So lifting this to abducting to 90 degrees, and then externally rotating, supporting the scapula. Any pain there?
No.
Fine, and then that's for assessing for anterior glenohumeral laxity. And this is posterior glenohumeral laxity, and it doesn't appear to be any positive test there. And the final test I'd like to do is the external rotator test to assess for the teres minor and infraspinatus. So can I get you to put your arms like that for me, and then lift your arms up like that for me? Okay, and just externally rotate, so rotate outwards, that's fine. And it doesn't appear to be any pain when doing that, so that's a negative test. So now I'd like to move on to neurovascular assessment of the right arm. So I'm just going to feel for the pulses, which are normal, and if you relax your arm for me, just assessing tone, which appears to be normal. There's no clonus, normal tone, and no evidence of any fasciculations. And now I'm going to assess your sensation. So this is what should feel normal. So if you close your eyes for me, I'm going to touch both arms, and if you just let me know if there's any abnormality in sensation. Does that feel normal?
Mm-hmm. Normal. 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 Normal.
Okay. So that concludes my examination. To complete my full examination, I would like to take a history and do an examination of the neck and the elbow and the opposing shoulder. I would examine the neck and the elbow because sometimes you can get referred pain into your shoulder. And then I would consider any imaging such as X-rays, CT scans or MRIs based on my clinical examination. Thank you.
Thank you.